Well, medical advancements have led to improving success rates among people battling critical illnesses. However, a side effect to this is that people are not getting back to work after surviving hospital care. It's called post-intensive care syndrome, and here to talk more about it from UC San Diego School of Medicine, Dr. Biren Kamdar. Welcome.
Thank you for having me.
Important topic because the study, well, first of all, as soon as I sat down, I said, this is surprising to me, and right off the bat, you said, these are young people, though, we're talking about.
Well, we think about critical illness, we think about an older person in the hospital recovering from a pneumonia or cancer. But a lot of these patients are not over the age of 65. They might be in their 50s or 40s, have the flu, end up in the hospital with the pneumonia, and end up in the ICU then on a ventilator for many days. And then they might leave with a lot of impairments after that, including inability to return to work.
So you did this study, and tell me some of the findings of the study.
So we did what's called a systematic review and meta-analysis, which is a comprehensive review of the literature. I worked with a team of researchers from all over the United States. We screened over 27,000 articles and found 52 from all over the world that looked at this topic. They enrolled over 10,000 patients who were previously employed before critical illness, and the findings were pretty sobering. We found that at 3 months after patients left the ICU, of these previously employed survivors, about 2/3 of them still hadn't gone back to work. About a year later, it was about 40% still hadn't gone back to work. And then 5 years after ICU, about a third of them still hadn't returned to work. And even worse, the ones who did go to work in the first year, about a quarter of them ended up losing their jobs after that.
That's what I highlighted. Why is that?
So we don't quite know. This is a very new area of research that people are very interested in because going to work is a big part of our identity, has financial consequences for not only the patients but their families and also society. So we don't quite know. But we do think, we hypothesize that maybe patients leave the ICU, they go home, and they go right back to their normal lives, or at least they expect to. And once they return to work, they find that they have these impairments that they often get when they're in the ICU, cognitive impairments, physical impairments, mental health impairments that prevent them from functioning normally at work.
So these post-ICU clinics, they're becoming very needed, clearly, because of this study, but also this is something you excel in at UC San Diego.
So UC San Diego has a post-ICU clinic. It's staffed by our medical ICU director, Robert Owens, and these clinics are special because while doctors are important for addressing these impairments, these survivors of ICU have a tremendous number of needs. They're often weak. They have trouble with their thinking. They have trouble at home. So they need people like physical therapists, occupational therapists, respiratory therapists, social workers, etc. So they need a multidisciplinary team to help them, and that's what these clinics help these patients with.
And why is this something that society on a whole and employers really need to be listening to?
Well, you probably didn't know this, but critical care is now 1% of our GDP.
Wow.
So our population of ICU survivors is only going to continue to expand as our care continues to improve and people continue to get older and work until later years. So this is slowly going to become a much larger issue. So we need to start thinking about what sort of impairments patients are going to have when they're in the hospital, when they're sick in the hospital, and think about how that's going to affect them once they leave.
Yeah, because it's full circle. It doesn't just stop when you... Wow, incredible study, incredible findings, and incredible work you guys are doing. Hopefully you'll come back and shed some light on some improving numbers based on the work that you guys are doing at UC.
I'd love to.
All right.
Thank you so much
for coming in.